Water, the essence of life, for without water, nothing can exist. These lush and green valleys of Azad Jammu and Kashmir and Khyber Pakhtunkhwa blessed with abundant water resources. But the devastating earthquake of 2005 changed all that. With death and destruction all around, these natural havens became a living hell for the people of the area, threatening their very survival.
As a result of earthquake, over 4,000 water supply schemes were destroyed. So naturally, water is always an issue, and we at that time not only thought that we have to resolve this issue and restore the old system, but we also studied that the old system had a lot of shortcomings in it. So when we started restoring the water systems, we thought that we would do it better and make water available at the doorsteps of the population.
Rebuilding of these water supply schemes scattered over rugged mountainous terrain proved to be a Herculean task for Earthquake Rehabilitation and Reconstruction Authority Watson sector, responsible for the reconstruction and rehabilitation of over 4,700 water and sanitation facilities in the earthquake-affected areas. The challenges that lay ahead were daunting, to say the least. Its immediate major task was to restore and repair the damaged water supplies, whereas for long-term measures, in line with ERRA's slogan of Build Back Better, these damaged facilities were to be upgraded and expanded to cater for future needs of the affected people as well.
जब पानी नहीं था तो हम लोगों को जो है वो कुएं पे जाना पड़ता था, दरिया पे जाना पड़ता था, तो थोड़ा मुश्किल होता था पानी लाना. जब इन लोगों ने हम लोगों को ट्यूबवेल बना के दी तो हम लोगों के घर पे पानी आने लगा.
However, patience and persistence paid off. With the numerous workshops and training sessions for villagers, implementing partners and line agencies, people soon realized the benefits of the ERRA's proposed methodology of rehabilitation and reconstruction of damaged schemes, especially women who had to fetch water from sources that were miles away.
इसी दौरान ERRA ने यहाँ पर ट्रेनिंग लोकल गवर्नमेंट के मॉनिटरिंग के साथ यहाँ पर ट्रेनिंग लोगों को दी और हमें वाटर टैंक और पानी के जीआई पाइप में असर किए और उस ट्रेनिंग से ये फ़ायदा हुआ कि जैसे ये जो एरिया आपने देखा मुश्किल है, यहाँ पर बाड़ी भी है, झाड़ियाँ भी, जंगल भी है. इस पर भी हम ERRA का बेहद शुक्रगुजार हैं कि लोगों में एक शौर पैदा किया ज़लज़ले के साथ साथ कि खुद इत्मीदी को खुद काम करना. मैं ये समझूँ कि ये पहले मेरे ख्याल यहाँ इस तरह नहीं था.
ट्रेनिंग से बहुत फ़ायदा हुआ है. जो कमेटियाँ बनी हैं उसमें एक तरीक़ाकार बन गया और लोगों को अब शौक़ पड़ गया कि ये हमारी जो चीज़ है, जो लाइनें बनी हुई हैं, इसको हम ठीक तरीके से चलाएं. पहले ये चीज़ नहीं थी. पहले की एक ही बात थी कि भाई गवर्नमेंट ने कोई लाइन लगाई है या किसी अदारे ने लगाई है, बस वो आएंगे ठीक करेंगे, बस इतनी सी बात है.
We developed a sense of ownership amongst the community. They owned the projects, and this was the reason that there were no impediments to our projects. And we got the full support from the line department, from the local bodies, from the local communities, local leaders. So therefore, I think because of this cohesion and unison, we were able to produce excellent results.
While keeping the provision of water supply as one of the very basic needs of human beings, ERRA gave high priority to its Watson program and started work at a fast pace. In spite of social, cultural and geographical challenges, the Watson Reconstruction program kept moving in a progressive way to provide water services to the doorstep of affected people. With the water supplies restored, the next big challenge facing the Watson sector ERRA was the quality of the water supply. In the short term, the concern was more towards the IDP camps, where water was tankered to almost 1 million people. But in the long term, ERRA had to concentrate on provision of clean and safe drinking water at the domestic level, for the rainy season brought bacterial contamination along with animal and human pollution.
That aspect we have taken care under a separate project during third year of the our project. We have come up with a comprehensive project of water quality improvement and promotion of hygiene, known as WAQIF project. The main objective is to take such measures so that these issues are addressed in a long-term manner.
This long-term strategy involved the establishment of water quality labs. So where there was only one lab before the earthquake in Muzaffarabad, today there are 8 more established with the assistance of World Health Organization, whereas 9 mini-labs have also been provided by UNICEF.
UNICEF has been part and parcel working with ERRA and with the local authorities to restore these water schemes. But also we have been addressing issues such as sustainability. The questions of the quality of the water supply is a concern of ours, ensuring that the water is actually clean and pure and healthy.
At the same time, it was crucial to sensitize the consumers, Watson managers, policymakers, senior bureaucrats and technocrats about the importance of water quality, which so far has not been given its due attention. Blessed with natural resources, the earthquake-affected areas received the highest rainfall in the country. This was a natural resource wasted since times immemorial. With the predicted water shortages in Pakistan, the Watson sector of ERRA saw this as a major opportunity to bring about change through promotion of rainwater harvesting in earthquake-affected areas.
It's a 496 million rupees project. We are going to address about 40,000 households who will be covered in this. I think 60 to 70% of the household water requirement will be met through rainwater harvesting. It's a very simple and a very economical way of saving water during the rainy season, and because of most of the roofs of the schools and other buildings and rural housing, they're tin sloping roofs. We put a gutter there, and through the gutter the water through a pipe is brought in a water tank, and in this water can be used for all the household chores.
आप ये मिसाल देख लेंगे जो हमारे ये टैंक बना हुआ है, ये हम बारिश का पानी हमने इकट्ठा किया है और उसके बाद लोगों ने अपने घरों में ये सिस्टम शुरू किया हुआ है. लोगों ने इसकी नकल उतार रहे हैं. आज हर घर में तकरीबन ये लोग कोशिश कर रहे हैं कि हम कोई मुहैया करके ये बारिश का पानी मुहैया करें, क्योंकि ये बारिश के पानी के अलावा हमारे पास और कोई सोर्स है ही नहीं. पानी बहुत नीचे है और ये 7,000 फुट की बुलंदी पे है.
But the Watson project goes further, with water supplies restored and the quality and quantity of water achieved. The next big challenge was to control disease and raise the level of hygiene through behavioral change and awareness raising at the community and domestic level.
पहले हमारे ख़ानदान में हमारे घर में बीमारियां बहुत ज़्यादा थी. जब से हमने ये सफाई के हवाले से, ये अफजान सेहत के हवाले से ये ट्रेनिंग की है ना, हमने 3 दिन की चट्टियाँ स्कूल में, तो उसके बाद ये हमने साबुन से हाथ धोते रहे हैं और तकरीबन अब उसके बाद काफ़ी हद तक बेहतरी आ गई है. बीमारियों से भी काफ़ी लोग बच गए हैं.
ERRA has been instrumental in improving the sanitary conditions of earthquake-affected areas, particularly in urban and peri-urban areas, through construction of proper drainage, street pavements, public toilets, slaughterhouses, and by providing solid waste management equipment to the municipal authorities.
ज़लज़ला के बाद हमारे डिपार्टमेंट को स्ट्रेंथन करने के लिए ERRA की सतह से ट्रैक्टर्स मिले हैं. 3 ट्रैक्टर्स, ट्रालीज़ और डस्टबिन्स शहर के अंदर जो नस्ब हो चुके हैं.
हाँ, फ़ायदा है. सहूलत है, बहुत बड़ी सहूलत है. तोड़ नहीं, दबा नहीं, कुछ नहीं, गंदगी नहीं. जाके देखो हमारी गलियों में साफ़ सुथरी हैं.
ERRA was well cognizant of the importance of the capacity building of the implementing agencies hence provided all possible support, including technical staff, logistic support, office equipments, etc. In spite of multifaceted sectoral activities and physical spread of the projects, over 30,000 square kilometers rugged area, ERRA Watson sector is well on track towards achieving its targets by completing over 84% of its work till July 2010. ERRA has planned to substantially complete its major work in the year 2011. But in the 5 years of its existence, it has worked tirelessly for the people of the earthquake-affected area in its resolve to live up to its mission statement.
All over the world, after any disaster, the programs are generally reconstruction programs, which is brick and mortar. Our program was reconstruction and rehabilitation. So this was not only about brick and mortar, but it was about building lives. So I think we have been successful in doing that. The quality of education has improved, enrollment has increased, water is better, health facilities are better. So I think these are few things which one can be very proud of, and I think we are lucky that we were able to do this.
हयात है, आबे